How does family accommodation affect OCD? Have you ever wondered how family dynamics can influence obsessive-compulsive disorder? Family accommodation refers to the ways family members, particularly parents, become involved in the compulsive behaviors of someone with OCD. This can include participating in rituals, providing reassurance, or helping the person avoid triggers that provoke their symptoms. While it may seem helpful, family accommodation can have significant effects on both the individual with OCD and the family as a whole. First, family accommodation can maintain and reinforce OCD symptoms. When family members accommodate compulsions or avoidance behaviors, they inadvertently prevent the person with OCD from facing their fears. This stops the natural process of becoming accustomed to anxiety triggers, which can maintain or even worsen OCD symptoms. The immediate relief that accommodation provides acts as negative reinforcement, encouraging reliance on these behaviors instead of developing healthier coping strategies. Moreover, higher levels of family accommodation are linked to more severe OCD symptoms and greater impairment in daily life. This includes difficulties in social situations and fulfilling roles at home or school. For children and adolescents, high family accommodation can lead to increased depressive symptoms and reduced overall functioning. Family accommodation also impacts treatment outcomes. Research shows that it can lead to poorer responses to cognitive behavioral therapy, which is a standard and effective treatment for OCD. High levels of accommodation can interfere with exposure and response prevention, a core technique in therapy. This interference can make it harder for individuals to face feared situations without resorting to compulsions, potentially increasing the risk of dropping out of therapy altogether. Additionally, family members themselves can experience psychological distress due to the burden of accommodating OCD behaviors. Parents may face increased anxiety and depressive symptoms, which can reduce their quality of life and strain family relationships. Recognizing these challenges, reducing family accommodation becomes a key goal in managing OCD. Family-based cognitive behavioral interventions can educate and support family members in resisting the urge to accommodate compulsions. These strategies help families learn how to manage OCD behaviors without enabling them, ultimately supporting the patient's progress in therapy. In summary, while family accommodation is often motivated by a desire to alleviate distress for the person with OCD, it can maintain and exacerbate symptoms, impair functioning, and complicate treatment. Addressing and reducing accommodation through targeted family support and education is vital for effective OCD management and recovery. If you or someone you know is dealing with OCD, consulting a healthcare professional can provide personalized guidance and support.